Hello and welcome to Anticlock Academy. I am Dr. Krishan Mohan Kapoor, and in today's video, we will be exploring the superficial fat pads of the face and how they play a crucial role in facial injectables. This information is not only important for understanding the anatomy of the face, but also for achieving natural and rejuvenated results in cosmetic treatments. The face contains distinct compartments of superficial fat, each contributing to the overall shape, volume, and youthful appearance of the face. Let's dive into how these fat pads they change with aging and how injectables are used to restore and enhance facial contours. The superficial fat pads of the face, they are located just beneath the skin and they play a major role in shaping the contours of the face. These fat pads are not a uniform mass, but they are separated into distinct anatomical compartments. Each of these compartments is independent and it has its own boundaries. Understanding these boundaries and the function of each fat compartment is very crucial for performing targeted, effective injectable treatments. These fat pads are responsible for the fullness and smooth contour of the face, especially in areas like the cheeks, nasolabial fold, and in under eye region. As we age, these fat pads they begin to shrink, shift, or descend, which contribute to the visible signs of aging such as sagging skin and hollowness in the face. Let's talk about individual fat compartments. Nasolabial fat pad is one of the most well-known fat compartments in the face. It is located near the nasolabial fold, which is a line that runs from the side of the nose to corner of the mouth. This fat pad lies just anterior to the medial cheek fat pad and overlaps with the jowl fat. The orbicularis retaining ligament above it represents the superior border of this compartment. Its superolateral boundary is the medial cheek fat pad. As we age, the nasolabial fat pad can atrophy or descend, leading to the deepening of these nasolabial folds. This contributes to the appearance of laugh lines or smile lines on both the sides. So restoring volume in the area with fillers can help smoothen these folds, creating a more youthful appearance. When talking about cheek fat compartments, the cheeks they contain three primary fat compartments: the medial, middle, and lateral temporal cheek fat pads. These compartments they work together to create the fullness and the volume that we associate with youthful cheeks. Let's talk about the medial cheek fat pad. The medial cheek fat pad is located lateral to the nasolabial fold, and this fat pad is bordered above by orbicularis retaining ligament, and it helps define the youthful fullness of the midface. Laterally, this compartment is limited by the zygomaticus major muscle and borders the middle cheek fat. Next is the middle cheek fat pad. This is located lateral to medial cheek fat pad and is bordered above by zygomatic ligament, and the medial cheek fat pad it lies medial to lateral temporal cheek fat pad. It plays a key role in the cheek projection. Caudal to the middle cheek fat pad here lies the inferior jowl fat pad. Then let's talk about the lateral temporal cheek fat pad. This is the most lateral of the cheek fat compartments. This fat pad connects cheek area to the temple as well as to the cervical fat. It lies in direct contact with the parotid gland and it connects the temporal fat to the cervical subcutaneous fat region. The cheek part of this compartment is very firmly adherent to the parotid fascia. At the level of preauricular region, the platysma auricular ligament it forms the posterior border of the lateral temporal cheek fat pad. This compartment is often affected by the loss of volume in the temples. It gives hollow or sunken appearance to lateral part of the face. Next, we talk about forehead and temporal fat compartments. The forehead and temporal regions, they also contain distinct fat compartments which contribute to the overall volume and contour of the upper face. In the forehead, in the middle, we have central forehead fat. It is located in the midline of the forehead, and this fat compartment helps maintain the smooth and youthful appearance of the forehead. Middle temporal fat pad is positioned on either side of the central forehead fat. This compartment helps with the transition between the forehead and the temple area. Whereas the lateral temporal cheek fat pad, this is the compartment which connects the temporal fat to the lateral cheek and cervical fat. As we age, the lateral temporal fat can diminish, causing a loss of definition in the upper face and in the temples. By injecting into these areas, we can restore the natural contours of the forehead and temples, creating a more youthful appearance. Next, we talk about orbital fat compartments. The orbital fat surrounds the eyes and is divided into three subcompartments: the superior, inferior, and lateral orbital fat. These fat compartments, they help to cushion and support the delicate structures which are present around the eyes. The superior orbital fat, this is located just below the eyebrows and is essential for maintaining the smooth and youthful eyelid in the upper eyelid area. Inferior orbital fat pad is found directly in the lower eyelid area, and this compartment helps to fill the area in the lower eyelid, and it prevents formation of tear trough or hollowness in the lower eyelid region. Next is the lateral orbital fat pad. This fat pad lies at the lateral corner of the eye, and it plays a role in the overall contour of the outer eye region as well as the temporal region. Jowl fat compartments are very important in the lower face, so they can be divided into superior and inferior jowl fat pad. Superior jowl fat is lateral to the modiolus, and clinically it appears as the most inferior extension of the nasolabial fold and of the nasolabial fat in this area. Its lateral borders lies against the middle cheek fat and its inferior border against the inferior jowl fat. The inferior jowl fat, this is located below the middle cheek fat pad and just inferior to superior jowl fat as just described. Its medial boundary is the mandibular ligament in this area, and the lateral boundary is formed by lateral temporal cheek fat pad, whereas the inferior boundary of inferior jowl fat pad is formed by mandibular septum. With age, the jowl fat can descend, contributing to the formation of double chin and sagging around the lower face. This can lead to the appearance of the jowls in this area, where the lower cheek and jawline, they lose the definition. In conclusion, the superficial fat pads of the face, they play a crucial role in shaping the facial contours, and understanding their anatomy is essential for effective injectable treatments. As we age, these fat pads undergo changes that contribute to the visible signs of aging, including hollowing, sagging, and loss of volume. By restoring volume to these fat compartments with dermal fillers and other injectables, we can reverse the signs of aging, improve facial harmony, and achieve natural youthful results. Thank you for joining me today. I hope this overview of injection anatomy of superficial fat pads has been helpful to you. Stay tuned for more detailed videos on injection anatomy of the face, and don't forget to like, comment, and subscribe for more insights into facial anatomy and aesthetic procedures.